now from Henry Ford Jackson Hospital, Vice President of Population Health, Dr. Courtland Keteyian. Welcome back to the show.
Thanks.
We are enjoying beautiful weather.
Yeah, it's nice right now.
Yeah, isn't it nice?
Yeah, it was a good couple days. These are bonus days.
But it's good. It's the colder weather that you get concerned about, and it's not with frostbite or anything like that. It's what colder weather does to the community.
Yeah, it brings us inside, right? And and so we worry about more communicable diseases spreading. COVID is one of them, but then obviously there's others. There's flu, there's RSV, just the common cold. People will get that too, but that's one of the things that I think people are really concerned about as we see that COVID hasn't gone away. Still quite a few cases that are happening in the community, and then kind of layering on some of these other sort of common respiratory infections, RSV and flu on top of that, and then you could end up still having a very, very busy year where a lot of people get very sick.
Well, let's talk about each of those, but first COVID. The president extended the national emergency for the country into January. He has made it clear that while it is still a pandemic and it's still a national emergency, it's something that we're going to just have to deal with and manage. And some of the precautions, some of the health measures that we've been under over the last 2.5 years, they've pulled back.
Yeah.
With the colder weather and the lack of masks and people not social distancing, and you can see it at a line at a coffee shop. Are you worried that the COVID's going to be coming back?
Yeah, I think very worried. Yeah, very worried. So, we have tracking testing numbers isn't really the best way to really get a sense of the burden of disease in the community anymore, because there's so much that goes around that's untested, and people do the rapid tests and those don't really get reported. So one of the ways that, which is really smart, is there's a few cities in Michigan where the University of Michigan has been tracking viral genetic material, RNA, in wastewater. And so Jackson's one of those cities. You can actually see how it's kind of trended. So we had really high spikes last year in the November, December timeframe, and then again in January. That's when we had our worst phases of Delta and then Omicron. This year, we've seen a pretty steady increase in concentrations since about July. And so right now, we look about like we did between those two peaks last year, so kind of the beginning of December.
Oh, wow. And
so there's quite a bit of COVID going around in the community. So set, flu and RSV aside for a minute, there's quite a bit of it out there. And we're seeing that in the hospitalization. So we've pretty consistently had all summer and now into the fall 20 to 30 people that are hospitalized with COVID. And so that's been very consistent. We're better at treating them, so the death rate's gone down, which has been really good. But we've still continued to see people that have struggled and not survived. The county's at over 600 deaths now. I think it's 607. So it's definitely not gone. It's definitely not gone, and we're still seeing that create quite a bit of burden, both in the clinics and then in the hospital, where we're still getting those cases.
So there are some things that we can do. The vaccine, which was anticipated to be the end of the pandemic, didn't pan out because we didn't get enough people getting the vaccine. Yeah,
and the virus also continues to sort of evolve. I mean, I think the end of the pandemic is sort of semantic. Are we going to prevent people from getting COVID now? Probably not. Can we prevent them from dying? We have really good tools that prevents long-term illness. So both death and then kind of the long-term symptoms. People get this long COVID where they're fatigued and brain fog and shortness of breath, and that can last for months and months. And people that are vaccinated are much less likely to have those types of long-term sequelae from the disease. So really good tools at this point, I think. The thing that people are keeping their eye on is we continue to have these variants evolve. And there's two variants now It's BQ and XBB. These sound like sort of Star Wars droid names at this point. But those are, BQ represents about 20% of cases now, especially on the East Coast, like New York, New Jersey. And these are all kind of the Omicron lineage of variants. These are subvariants. Then the XBB is in Southeast Asia right now. And so those are things that, as we get a variant that's a little better at spreading, it tends to kind of take over from the one that's circulating currently. And the one currently circulating is the Omicron, which is the BA.5 variant. And so that's about 80% of cases right now. So we kind of track how these things respond to our vaccines and our treatments. And the thing that's a little scary about the BQ variant is that the monoclonal antibody, which has been one of our sort of mainstay treatments, it appears to be resistant to that.
Oh, wow.
So that's the vaccine really does. You can't always rely on the fact that there's going to be something that helps treat it after getting it. The vaccines, even as they've evolved, have been really good at preventing the really severe outcomes.
And we now have a new and improved vaccine booster.
That's right. Yeah, that's right. So it was just over Labor Day actually that the CDC and ACIP approved and recommended the bivalent vaccine. So bivalent just means bi is 2, and so it basically protects against different strains. And so this is the BA.4 and 5, which is the more common Omicron variants at this point. And so the recommendation is for people to still get a primary series, which is sort of the original doses of vaccine, and then to get a booster 2 months later with this sort of specialized for the more recent Omicron. The other one that's worth mentioning, and that's for ages 5 and up, by the way, so that's approved ages 5 and up. There's not a booster recommended for kids under 5 right now. The other one that's interesting to mention is there was another vaccine approved. There's now 4 U.S. vaccines. This was called Novavax. Novavax is a protein-based vaccine, so it's not the mRNA technology. Mm-hmm. I know there's been quite a few people that are sort of more nervous about the newer mRNA technology. Novavax is protein. That's the same as like a tetanus shot. So it's been around for 30 years that we've used this type of technology. And that's approved for a primary series and then also a booster. And you can even have it as a booster after an mRNA primary series. So somebody that might have had an allergic reaction or something to an mRNA vaccine, now you can get this other protein vaccine. So there's really like a lot of options. And that's been something that's been useful for us at the hospital for our employees. Because we had employees that had a reaction to one vaccine, sort of expected some people are going to get an allergy or something. And now we can actually now we have this other option. So it's worth people, I think, who are interested in getting vaccinated to really look at that.
Is there any value to getting both the mRNA vaccine and the protein vaccine?
No.
No.
It's you would you just want to get a primary series and a booster, and for some of us this will be our second or third booster depending on our age or what's been recommended. So this was my second booster. People over 65, this could be their third booster. Mm-hmm. If they're immunocompromised, they might be on 4 or 5 at this point.
Yeah, I think I'm on. I lost track. I think everybody has. We don't know.
Yeah. Yeah. It's pretty clear this is going to become, it's been included now in the annual vaccine recommendation list, the COVID vaccine. So, this is going to be an annual thing that we'll get added in. No, it's not. It's not.
And we hadn't, I don't even know if we had the chance, but like polio, we, as a world, we decided we're just going to kill this, but we didn't react that way with COVID.
No, and actually, as we've seen vaccine hesitancy rise and vaccination rates decrease in parts of the United States, there's been cases of polio in the United States. There's been cases in New York, which is terrifying.
Yeah. All right. So last week, headlines everywhere about the RSV, which is a respiratory virus that affects just kids.
No. It's most common. It's a very common childhood illness, but it ends up infecting kids at daycare, school, whatever, and then transmitted to parents. Very similar to COVID.
And it spreads like wildfire.
It spreads very easily. Yeah, and it's another upper respiratory virus, so people get runny nose and cough and might get a sore throat, things like that. So It's a very similar symptoms. And that's actually a really important point to make is whether it's influenza, RSV, respiratory syncytial virus, or COVID, you can't really tell what it is based on symptoms. So people will say, yeah, I just have a cold, it's not COVID. The only way to really know is to get a test. You really have to get tested. They did a study in the UK called, it's the ZOE study. And on the most recent sort of, this has been in the last couple months actually. And the most common symptom now of COVID is actually sore throat.
Sore throat?
Sore throat, yeah. So sore throat, runny nose, different than the initial kind of fever, shortness of breath, and cough. So those are still there, cough is still there. The thing people always kind of associate with COVID is a lost sense of smell. And that's only happening in really 20 to 30% of people at this point. So you can't rely on the same symptoms. Really, like if it's an upper respiratory thing, runny nose, cough, congestion, sore throat, you can't just go get a rapid strep test and call it a day. You really need to have a COVID test. In most places, if you go to like an urgent care, or your PCP's office, they'll test you for multiple things at once. You can, off of one swab, you can test somebody for flu and for RSV and for COVID. You don't have to get, all these different things run. It can be done at once. But that's nice. It's nice because it helps the doctor know what they can do to treat, because there's treatments for flu, there's medications, and there's treatments for COVID. There's medications for that too.
So if someone has this runny nose, sore throat, they think it's just whatever, they hope it'll go away like it usually does. Should people go to a doctor or urgent care or get a test?
Absolutely.
Absolutely.
Yeah, absolutely. There's no reason not to get tested. The tests are so available. I mean, over the counter at the drugstore. Doctors' offices, urgent cares. Please don't go to the ER just for a COVID test. ER is busy enough. But there's a lot of settings where people can go. We still have the drive-through testing available. I mean, there's really a lot of ways to get tested, so would really encourage people to go to those environments and get a test done.
I think what was concerning, why we did see banner headlines, pediatric hospitals in 6 or so states said, "Oh my gosh, it's a pandemic of RSV." Having to hospitalize a kid, that's pretty scary.
Yeah.
So there is a stage of this RSV that cause someone to have to be treated in the hospital?
Yeah, I mean it's pretty common, and so in a normal year, there will be somewhere in the 20 to 30,000 death range from RSV actually in this country. Flu will cause 30 to 90,000 deaths depending on how severe it is. COVID has been causing 400,000 to 500,000 deaths a year. For the last couple of years, so they're all additive now, right? So you start to stack these things on top of each other, and that's where I think people are concerned. And the worry with RSV and flu this year is typically there'd be some kind of immunity in the community already, but because we've been kind of isolated, wearing masks the last couple of years, the flu and RSV have been basically non-existent, and so there's concern that we'll see worse versions this year. So flu shot is also very important. So both, I got my flu shot on my left arm, COVID on the right arm. So it's really important to get both vaccines this year.
See, I got them both in one arm, and that was bad. That was a bad decision on my part.
Yeah.
I'll know
Testing
better.
how tough you are there. Yeah.
Yes. Next time I'll know better. Great to see you. Thanks for all that you and everyone on your team doing to keep our community safe and healthy.
Yep. Thank you.
Vice President of Population Health at Henry Ford Jackson Hospital and President of the Jackson Health Network, Dr. Courtland Keteyian.